pelvic pain, excessively heavy periods, bloating, urine leakage, bowel issues, constipation, diarrhea, distended abdomen, pants getting a little tight. Yeah, you're not alone. There's a lot of women in your position. Let's talk about it. First of all, I'm Shannon. I'm your friendly neighborhood midwife today. Let's talk about fibroids. What are fibroids? Fibroids are benign, non-cancerous growths that occur on the uterus, in the muscle of the uterus, or inside the uterus. These can be there for years and you have no symptoms. Some women can have some little ones and cause massively symptoms. So let's talk about each type of fibroid and what they may mean to you and how they may affect you. First, let's talk about intramural fibroids. So intramural fibroids are the most common types of fibroids, and they are located in the muscle of the uterus. They may start out small at first and may not cause many symptoms, if any at all, but over time, as they grow, they continue to cause more and more discomfort and more symptoms. Common symptoms of intramural fibroids are going to be heavier periods that may last 10 days or more. They're going to cause irregular bleeding between the periods, and they can cause lower back pain or pelvic pain, anemia from the severe blood loss that can occur with these types of fibroids, and they can cause fertility challenges. So this is the first type, intramural fibroids. Then we're going to move on to subserosal fibroids. Subserosal fibroids, they protrude into the abdominal or pelvic cavity, oftentimes causing pelvic pressure, pelvic pain, fullness, constipation, bloating. They have an impact on the bladder because they're taking up, it's causing the uterus to take up more than its fair share of space in the pelvis, and therefore they cause the most issues. Now, the third type of fibroid that we're going to talk about are submucosal fibroids. Submucosal fibroids grow within the innermost layer of the uterus called the endometrium. Symptoms associated with the submucosal, heavy, prolonged periods. This is the most common thing that cause women to present to providers to be checked out. And one of the most common symptoms that are dismissed because women attribute these symptoms, well, my mom had a heavy periods, my aunt, my grandma, my best friend, everybody around me has had heavy periods like this. So this has got to be normal. And why would I go get care for something that's normal? So a lot of times the symptoms are dismissed. Even the smallest fibroids can cause this severe bleeding, causing women to seek professional care. Other symptoms include anemia, dizziness, weakness, lightheadedness, passing large clots during your cycles. All of these can be common or are commonly reported by women with these types of fibroids and often are the catalyst for them seeking care. Now, let's talk about who is most likely to have a fibroid or to be diagnosed with fibroids. The most commonly diagnosed women with fibroids are going to be between the ages of 35 to 54, and most commonly are diagnosed within the reproductive years because those women are having babies or trying to have babies and they're having difficulty, or they didn't have any problems getting pregnant. But what happens in pregnancy? You get ultrasounds, and ultrasounds are the primary way to look and see and diagnose fibroids. Family history of fibroids also increases a woman's risk of being diagnosed with or developing fibroids. African American women are more likely than any other race to be diagnosed with fibroids. Some other factors that may be linked to fibroids: birth control use, vitamin D deficiency, a diet high in saturated fats can also contribute to the chances of you potentially developing fibroids. Now, what options do women have to deal with fibroids? Well, there's a lot of options. It's going to depend on where you are with childbearing, how much is this interrupting your life, and how heavy is the bleeding? Is it having an impact on your labs? So the first thing that women can do, you can do nothing. You can keep an eye on your symptoms. You can change your diet and exercise, eat healthier, make sure that you are exercising 5 to 7 days a week for at least 30 minutes. Weight loss, not going to have necessarily a significant impact, but it's something that you can do. And there's many fad diets out there and recommendations to help deal with fibroids. Nothing that I've been able to find that has been long-term beneficial. Next thing, medical management. And that's going to be looking at medications that help to aim to decrease the heavy menstrual bleeding associated with fibroids. And they have specific medications for that. And then you're looking at hormone therapy, as in IUDs or birth control pills, to help keep that bleeding in check. If you're done having children, there are other options if you're not done having children. So the next things that are going to be available are going to be surgical interventions. One of the most popular or growing in popularity interventions is going to be something called a uterine fibroid embolization, or it might be termed, or you might hear just UFE. And that is where a interventional radiologist goes in and blocks the blood vessels that supply these fibroids. The next surgical procedure is going to be a myomectomy. And that's where you go in and have the fibroids surgically removed from the muscle by your gynecologist or a trained surgeon. And then the final option, if you're done with childbearing and they are having a massive impact on your life, is going to be hysterectomy. You have a lot of options available. Surgery is not 100% of the time the only option you have. And a lot of women are kind of made to feel that way, but that's not the only option. And if you are not comfortable with that, and that's what your provider is suggesting, seek another opinion. Go see someone else and go get another opinion. Now, fibroids can have a huge impact on your life, but dealing with the fibroids, while it may be aggravating, deal with them, get them taken care of so that your quality of life is improved and that you don't have to feel so bad. You don't have to feel that way. Your mom didn't have to feel that way. Your aunts didn't have to feel that way. So stop, change, make a change, and see somebody. I hope this information was helpful. I hope I was able to teach you something, answer questions you might have had. If you have any concerns or questions, leave them down below. Give me a like and share to somebody who might find this information helpful. I hope you guys have a great day.